fact, so in doing your meds, you want if your meds come in a liquid version, you want to use that. So you can check with the pharmacy to see if it's supplied that way. If there's no other option, then you can crush the pill or open a capsule, but you want to make sure that that's okay with that particular medication that you're giving, that it can be crushed. Not all medications can be. So in the hospital setting, they have these little pill crushers. Have you seen them? It's like, they look like a pounder. They're metal. Too bad they don't have one here. And instead of this size, they have little paper cups, smaller than this, that fit right in to a depression in the pounder. So I always put one of those in there rather than crushing directly into the pounder itself, because you don't know what other medications have been crushed in there. You don't want part of other medications getting in there. So you would put the white little medicine cup in there, put your pill in, and put another one on top. And then this little pounder has an arm that goes into here, and you just pound it until it's all crushed.
At PCC, they also had like little plastic pouches, like little tiny little bags that you slip the pills in. So bags.
Oh, so then you crushed them in the bag? So anyway, there's a couple different ways of doing it. So then you would want to dissolve that in fluid and like saline or water. So you can draw, it doesn't have to be a syringe quite this large, but you know, draw up the saline, put it in the crush pill, mix it around. They have different things to mix with, and make sure it's dissolved. You don't want a whole bunch of big particles left in it, because if they can clog up the tubing, because you can see the tubing isn't all that wide at the end, and it has to come out these little holes. So you don't want little chunks in there, because you're going to clog all this up. Then you have a big mess. Okay, so you want it dissolved. Each medication you draw up separately in a syringe. Now you've made it liquid. And you label it before you take it to the patient's room. So all of that's done in your med room before you go. Okay, all that crap on the bed. And you're going to need a flush, and for initial flush of your NG tube, and after each medication that you give. So if you're giving 3 medications, you would flush in between each medication that you get.
Is it okay? In the video, she used tap water. Is it okay?
Yeah, it's all good. It's like drinking water. It all kind of goes in the same place.
Okay, that's fine.
Do we have to check the amount of the residue that's in the contents that the patient has in the
Yes,
stomach?
because when you go in, you're going to aspirate
Yeah.
that.
So we spray